Next, we'll take up Conference Committee Report 1458. Senator Laurie.
Madam President, I move the following recommendations in Conference Committee Report on Senate File 1458 be now adopted and that the bill be repassed as amended by the Conference Committee.
Senator Laurie, you want to tell us differences in the Conference Committee Report?
Sure. Members, I rise to present the Conference Committee Report for Senate File 1458, the Omnibus HHS Finance Bill. I am going to keep this as brief as possible. I know it's been a long week for all of us, myself included, and this bill represents what I would call a real compromise, a compromise on many of the competing priorities for the state of Minnesota. And like any budget year, there's always more we wish we could have done, especially in the area of health and human services. It's a familiar struggle for us. When we went into conference, we were $1.5 billion apart. The Senate had proposed an investment of $341 million, while the House had a purported $1.1 billion cut in the health and human services area. This bill today represents an agreed-upon target of $301 million below the base for HHS. With additional savings found, we were still able to do many critical investments in this bill. However, I would be remiss if I didn't mention two significant losses for the Senate's HHS bill this year. In a time of a $2 billion surplus, it's disheartening that we couldn't find a path to increase the family income standard for families with children in our Minnesota Family Investment Program, as purported by the Senate. This standard hasn't been increased in almost 30 years, and the simple fact is, to truly invest in narrowing our achievement gap, we cannot leave an entire generation of children behind in deep poverty. It is our job to make sure no child is invisible. I'm also disappointed that instead of trying to make health care more affordable for all Minnesotans, we are increasing costs for low-income, hardworking families on MinnesotaCare. However, I am thankful that both the state and the healthcare community continue to recognize the value of MinnesotaCare and are committed to looking at ways we can continue to move Minnesota forward in healthcare. I'm also pleased we were able to make many critical investments in children and families, in healthcare, in mental health supports, in our disabled and aging populations, as well as supports and services for homelessness. I'm just going to read briefly of the major changes in the bill and stand for questions, and hope we can get a great deal of support. So in the first section, investing in future generations, a big change is child support disregard of $100 per month for MFIP families. This is a $7.9 million investment. Reducing the basic sliding fee wait list, we had gone in with a $20 million investment here, had to reduce that to 10, but it still offers quality child care to 440 families. We were able to pick up a House provision for reduction of the parental fees for our TEFRA families, a 10% reduction, an $844 million item. Also, hunger solution grants for mobile food shelves, a House position, $2 million investment there. Then in investments in healthcare providers, we have a MA payment increase for dentists of 5%, costing $3.3 million. That was a House provision. We did lose on dental a very important Senate provision.
Go ahead, Senator Laurie. I was having trouble hearing.
That Senator Rosen had worked very hard and put together. The Senate had come in with about $14 million of investments that would have really restructured how dental payments for our public programs worked. We weren't able to keep that in the final bill, but we're going to keep working on that. Health professional education loan forgiveness, a $5.2 million investment. This was a reduced investment from how we went in, but still going to do a lot of good work. Gillette Children's Hospital rate increase of $3.9 million, a House provision we picked up. An MA rate increase for PT, OT, and speech therapies, $347,000 House provision we picked up. A Merck increase of $2 million, a House provision we picked up, and then a primary care residency, another House provision for $3 million for healthcare workforce. In mental health, one of the things that we went in with was a very strong mental health proposal, and when I had to try to cut back, we had to make some decisions, our conferees, about whether we tried to just reduce everything proportionally or whether we maintain our focus on a couple of high priority items. And we did decide to maintain our focus on mental health. We still have intact the $38 million of mental health investment that we went into conference with. One thing that we did change was we increased the Beltrami County Mental Health Hub from a $500,000 investment going into conference committee to a $2 million investment. Otherwise, we kept that commitment. Increasing access to care for persons with disabilities and seniors. We picked up the dementia grants that we talked about on the floor when we were here, and on that same issue, the Senate went in fully funding SHIP, but the House had proposed eliminating it, and one of the things that we did as a compromise was to sort of restructure SHIP, the statewide health improvement program, to bring some accountability to the program and to add a third category of eligible grant activity. I think many are familiar with the fact that SHIP was intended to reduce tobacco use and obesity, and we're now going to allow potential grants in the area of dementia and aging, and it should really help those existing SHIP conversations embedded in our communities reach out and integrate across generations and really move us forward, and then the additional accountability added will also be welcomed. So, and then also some advanced care planning grants, $250,000 one time we picked up from the House, deaf and hard of hearing grants, a House provision, $1.5 million, and we also picked up the Statewide Quality Council, a $1.1 million House provision. Support of caregivers of our most vulnerable. We have a $138 million investment in our nursing home industry to bring our nursing homes up to the true cost of providing care for our seniors. This will be a tremendous help for a very struggling industry for a long time and really bolster the work that our caregivers are doing and make that care more quality care for our seniors and our communities. A few cost-saving items that we picked up in order to accomplish these. MinnesotaCare, as I mentioned in the intro, we increased premiums and cost sharing to reduce the costs to the state by $65 million. We took a House provision for a managed care payment delay worth $135 million one time. We picked up data matching for continued eligibility at a savings of about $25.8 million in 16-17, and we accepted a healthcare access fund transfer to the general fund for MA costs, a $450 million one-time transfer. And then in addition, we repealed a 2012 enacted OLA audit for $1.18 million. Also in this bill, we were addressing MNsure. At the end, we had a couple of stabs at trying to come up with some sort of compromise. You know, the Senate went in with repealing the MNsure Board of Directors and creating a state agency. The House had a very different approach. They weren't too interested in ours, we weren't too interested in theirs, but there were several items we thought we could agree on. We were pretty close to some more meaningful reforms, but couldn't quite get that across the finish line, but we did agree to several items that I think will help. We agreed to a 30-day rate release prior to open enrollment period so that the rates will be known before we roll into open enrollment periods in the future. We agreed to request a waiver from the feds for shop exchange for our small businesses. We agreed to a waiver for trying to provide individuals tax credits for health insurance plans purchased outside of MNsure, qualified health plans. We agreed to remove the exemptions that MNsure had from Minute and from the Department of Administration, and we picked up the prohibition on sales of other product lines. But we did maintain the current governance structure of MNsure and didn't make great disruption there. So, members, as you can see, we were able to accomplish many of the Senate priorities while picking up many House priorities as well, and I hope you vote green. I will stand for questions.
Discussion of Senate File 1458. Senator Hayden.
Well, thank you, Madam President, and I rise to support, obviously, Senate File 1458 as a conferee. I wanted to just thank Senator Lori and also the conferees in both the House and the Senate for working awfully hard to try to bring in something that at the beginning looked to be something that we weren't going to be able to come together with, and to figure out some creative ways, to say the least, in order for us to meet the needs of Minnesotans who need the service of the Health and Human Service Committee. And so, Madam President, I would be remiss in saying, though, that there were a few things that we missed this year. Many of you know that the Minnesota Family Investment Program, which is a jobs program that allows low-income people to receive financial and other services, including food service and others, for their families in exchange for them to continue to look for a job and to build their skills. And Madam President, the members may know there has not been an increase in the cash portion of that program since 1986. And many of you might have seen kind of a campaign that the advocates had that talked about where we were and what we looked like in 1986. And I know they had pictures of Senator Lori and others and what they looked like in those days. You know, some of us had business in the front and party in the back. Senator Lori. So it just gives you a sense, Madam President, in all seriousness, of how long it has been. And we had a proposal, and I think even the House had a proposal in different ways in order to fund that for low-income Minnesotans, and we think it's a long time due. And Madam President, it's going to be 30 years next year in which we kept that the same. And so we talk about a cost of living increase all across all of our programs here, and these low-income folks have not been able to get it. And so I was very disappointed that we weren't able to keep that provision. I also was just a tad bit disappointed that we weren't able to fully buy down the sliding fee program. We were able to put $10 million in it, which about 450 families. Early childhood, members, we talk about this a lot, and we're hearing about it each and every day, about early childhood. We're going to hear about it probably later today or tomorrow in the Education Committee, but there is an early childhood component in the Health and Human Service, which is called the sliding fee or the seed cap program, and we could have done a much better job in fully funding that in a targeted investment in low-income families to make sure that their children have quality child care. So there are a myriad of things that I could say that I wish we could have done more in a period of a budget surplus, but with the target that we had and the ability that we had to do to sit down in a very short amount of time and really come together and to find it, I do want to thank Senator Lori, Chair Lori, and all the members of the team, including, and a bipartisan group of folks, including our health policy chair, Senator Sharon, Senator Franzen, as well as Senator Rosen, and then the other conferees in the House. I really do feel like we've done a good job, but members, we are going to have to continue to focus. Our folks are getting older. We are treating our folks in the disability community in a much better way, and they are contributing to society, and we have to make sure that as our workforce continues to grow, that there are a lot of low-income Minnesotans that we are going to have to continue to fight for. And so, members, I hope that as we continue in this unprecedented amount of prosperity, that we remember those that are low income so that they can participate. So with that, Madam President, I do ask for members to have a green vote, but I do want us to remember that we can do much better in this state. Thank you, Madam President.
Senator Gazelka.
Thank you, Madam President. Will Senator Lori yield?
He yields. Senator Gazelka.
Senator Lori, first of all, I know that this is one of the harder conference committees to work on to find solutions for the many problems that we have, and I was particularly thrilled to hear that we have the same reimbursement rate for all nursing homes across the state now. In many of the areas that are deep rural, they were sorely underfunded. And that I was particularly happy about until I saw how much we were spending now and what we're going to spend in the future. And I see that the increased projected spending for year 18 and 19 is 18.8% increase. This time it's 11.5%, but if you take away or add to that the shift that we did from the Healthcare Access Fund to $455 million, the increase this time was over 15%. But my question, Senator Laurie, is that 18.8%, do you have any thoughts about how we're going to pay for that huge projected increase in costs?
Senator Laurie.
Madam President, Senator Gazelka, you know, I think it's kind of odd how we put this bill together. I actually did have a little bit of concern about how we used shifts and gimmicks to get through the 16-17 biennium, and what that looks like when you use one-time money in that way is some tails issues, and that's what we're working on, and we'll have to come back and work on those in future bienniums. But it's an issue. I recognize it. We used one-time money to get through the 16-17 biennium. I recognize that.
Senator Gazelka.
Madam President, and thank you, Senator Laurie, because this was a House-Senate agreement. But I am, just be noted that 18.8% projected increase into the future, and using up all the healthcare access funds means there's no money coming from there. We got a big problem looming.
Senator Chamberlain.
Thank you, Madam President and members. Right on the tail of Senator Gazelka, I too would say thank you for fixing the nursing home situation for the state of Minnesota. That was much needed. But beyond that, you can't say much. This is a bill to break the bank with little reform anywhere else. You found money for the nursing homes, but our home and community-based services employees didn't get see any relief or reform for the next this coming biennium. 15% increase in total this year. I think we have to keep we have to remember that and keep saying it. Senator Laurie, Madam President, I've heard this so many times. I understand it's one-time money. We're trying to fix the problem. This problem is worse than it was 4 or 5 years ago before MNsure came in. MNsure was supposed to help solve this problem, but here we are. 15% for this biennium, 20%, nearly 20% for the out years. So thank you for the nursing homes. But at this rate, there's not going to be anything left for anybody else. This is astonishing spending of money with no reform and no vision of where that's going to, how that's going to work out. After all these years and after all the work and hundreds of $millions in the MNsure to solve this problem. And we have 15% this year and nearly 20% the next biennium. So good for the nursing homes, but you left HCBS behind, and this is just amazing. Thank you.
Any further discussion? Senator Sharon.
Thank you. I wasn't going to speak to the looming difficulties that we have in the cost of health care, but they're real. Taking a look at what the cost drivers are, we ought to be in the future taking a look at how we can get some cuts and reforms in the cost of pharmaceuticals. We have to take a look at being able, through the kinds of reforms that the Democratic policies have in this bill, which are not parentheses on a spreadsheet for cost savings that are really coming from hopes and guesses about numbers rather than really solid fiscal analysis. What we did instead is put our money into processes that we know in the long term can create a reduction in the cost of health care and a lowering of that trajectory. Not necessarily in the 2-year budget that you're looking at, but in the long term. And we did that by doing a number of protections to keep in this budget those things that we know if we invest in them, that they have the capacity for long-term savings. For example, One of the things you can be proud the Senate did was protect the visiting nurse program. The visiting nurse program was completely eradicated, and we protected it. And what that meant for long-term costs in a variety of the divisions of the state is that as a result of the nurses going out and visiting families that are at high risk, early intervention, that we can assist those families to get those children on the right course, to help those families avoid other difficulties that cost us a very great deal of money in society. Those are the ways in which the Democrats have put bills forward that create cost savings in the future, rather than using parentheses on a spreadsheet around numbers that were just a guess and by golly. I really admire the work that Senator Laurie did to confront those discussions about finance and how numbers were put into this budget by the House that really were not valid or based on any kind of true fiscal analysis. So what you can save about the future and the fears that we have for the growing number of seniors that will need care, that consume probably 70% in chronic disease and in disability care what we spend, and that's a growing number of people and will drive up these costs, that it is the reforms that the Democrats are putting in place that will change the trajectory through prevention of those kinds of expenditures by putting people in less expensive care rather than the most expensive care. The right level of care for the acuity is what we're going to be able to do to create cost savings. Saving the visiting nurse programming, putting in place the ability to save MinnesotaCare for the period of time that we are actually able to pay for it, rather than prematurely throwing people off of an important program that provides services for them so that they don't continue to deteriorate in their health and have to go to more expensive care. So I'm very grateful for those kinds of initiatives that are going to create cost savings in this budget in the long term. I'm also disappointed about a number of things in the bill. I'm hoping that Senator Rosen will speak at some time to talk about dental access and what it was that we really wanted to do in this session, when we had a surplus and when we could have been able to do so much more to be able to help people have access to dental care, especially in the rural part of the state. I'm particularly proud of the child protection work that is in this bill. This has been a major initiative. It was one of the top initiatives of the Minnesota Senate DFL, Senate File 4. We have implemented and funded a significant number of reforms, assistance to the counties to help them implement those reforms, doing it in a way that requires counties to make certain that they're not supplanting their existing expenditures, but really using the resources we send them to improve their program, and focusing on the paramount concern we have that all that we're doing is in the best interest of children. Also in the child protection changes that we've made is an increasing awareness, became recognizing that there are certain populations in this state that have higher numbers of being in the child protection and child welfare system. And those very special communities that are reflected, these disparities that are occurring in those populations, will see some money that is very specifically directed towards trying to find real solutions at changing that trajectory in which we increase the number of people who are in this child welfare system and the child protection system that come from very, very special communities. One of the things I'm really happy that we finally were able to fund in this bill was some money for the non-emergency medical transportation. There's so many people here who may not even remember how long we've been working on that program. This is about the 8th year. I remember the first year that we started, this entire legislature was up in arms about what was happening with the non-emergency medical transportation program, concerns about what we were incentivizing, who we were paying, who we weren't paying, and whether or not those who need that very special kind of transportation would in fact get it in a way that was meant through the medical assistance program. We finally have made a number of reforms in this year. We have finally been able to put some money towards those reforms, and I'm very grateful to Senator Laurie that he's been able to find a way to do that. We've increased chemical dependency rates. This is, I think, the first time that they have had an increase in their rates in 20 years. This is a very important treatment program for people throughout the state, and this is just the work of the people in these programs, whether it's for the disabled or the chemically dependent or in the nursing homes. They're working at such marginal wages. So for us to finally give the CD providers a minor increase is really a wonderful thing. It's not enough. I'm also very happy because we've had a number of struggles with nursing homes in the rural part of the state to see us be able to use a great deal of the resources we have in order to support them as well. We've made a major commitment towards mental health in this bill. We started out at the beginning of the session saying that was a priority, and we hung in there with it. We stayed with it through the time we made the persuasive arguments with the House to continue to make investments in mental health. So that's just the surface of the important initiatives that are occurring in this bill. I'll just return to my original point because there have been comments on the floor in relationship to a very good bill about what's going to be happening in the future, and we can tell you for sure the costs of health care are going to go up. The reason that they're going to go up is because there are going to be more and more older people with the baby boomers. The reason it's going to go up is because the cost of pharmaceuticals is going up exponentially. We have not been able to find a way to reform that. We know that the costs of health care are going to go up through DHS because our disability community is living longer, which we like because the quality of the life that we're providing for them is better. But along with that will be continuing and sustained long-term costs. So we do need to find the ways to reform those programs, but they don't come by putting parentheses around numbers or cutting or slashing these important programs like SHIP, which we finally protected again in this bill from major cuts, because we've demonstrated that by investing in that prevention program, we have in fact reduced obesity in this state. We've reduced smoking in this state. And we know that those are two of the drivers of the most expensive parts of healthcare, which are chronic disease. So those are the kind of investments we need to continue to make. We protected them in this bill. We could have done better because we had a surplus this year and we could have invested in those kinds of things that really, really would change that trajectory that everybody's talking about and concerned about in healthcare.
Senator Benson.
Thank you, Mr. President. And Senator Laurie, once again, I want to thank you for running a fair and thoughtful committee. Tonight I rise out of, frankly, frustration. When I came into this year, I thought MNsure was so broken that I would get a chance to sit down and do real work. And I believe I made good, earnest efforts in making changes. But unfortunately, the fundamental reforms that MNsure is going to need didn't survive into this bill. Its organization and fiscal structure are not sustainable. As others have mentioned, there is much spending growth in a time when we're going to have to do very hard work, members. As hard as Senator Rosen worked on dental, as hard as Senator Sharon worked on non-emergency medical transportation, we are going to have to work very hard at figuring out how to contain cost growth in these budgets. We've put the provider tax basically back in play with this budget. It's disappointing that a lack of dynamic scoring in our fiscal analysis punishes programs like the one Senator Franzen brought forward for high-quality home visiting. We could have dynamically measured it, put that into the tails, and then tested against it to see if the promises stood up. But we don't get to do that. And members, for me, the most frustrating thing is that I will have to vote no, simply because there is so much spending in the current biennium and into the tails that I don't know how we sustain this long term. And so members, everyone will have to vote their district. There are many good things in this bill, but I rise in grave concern over the spending that we are going to have to face going forward.
Senator Nelson.
Thank you, Mr. President. First, I'd like to address two things that give me pause about the bill before us today. One is the shift from the healthcare access funds, especially in a time when we have surplus and money on the bottom line. So that does give me great pause as I look at the bill before us today. And I will say that I do believe there are some real missed opportunities in the bill that we have before us, I should say tonight. And one of them does have to do with MNsure reform. We should be reforming MNsure as other states have adopted the Affordable Care Act that would allow all qualified health plans, those that meet both state and federal guidelines, they should be on the exchange. We have Exhibit A as to why our government active purchaser model does not work, and all we have to do is look at what happened with Preferred One not being able to continue on in the market because, I believe, of the active purchaser provision that we have in this state. Also, the missed opportunity that we have regarding the risk pools. The way we have MNsure set up with the risk pools, very small risk pools in some areas of the state and very large in others, has caused a great inequity in the way those premiums play out. But members, that would be an incomplete story. I also want to tell you about the things in this bill that I think are notable. And first, I want to thank Senator Laurie for retaining and putting in the dementia grants. We know that those dollars will help our communities across this great state become more dementia capable. They will help connect caregivers with existing resources. They will help dementia patients stay in their homes and communities longer, saving families and state pocketbooks significant amounts of money. So I appreciate greatly that those dementia grants are in this bill today. Also, things that I have heard from my district, I see addressed in the bill that we have before us tonight. The additional funding for our nursing homes was long overdue and necessary. And in addition, I like the payment reform that deals with payment designed and tied to quality care. I think that is a model for us going forward in other areas. In addition, the increase in the dental rates are again long overdue. We've had great swaths of our state where people could not get dental care because the reimbursement rates were so low, there were no dentists to provide that needed care. And I also appreciate the support of the mental health and the chemical dependency rate increase, particularly. And in regards to the mental health crisis services, again, something that is much overdue, certainly needed. And we have long heard about the lack of psychiatric treatment beds for kids under age 21. It's really at a crisis in this state. And I'm glad to see that there is provision there to add 150 more beds. And also that we are paying special attention to the first episode of psychosis. Those type of things can help Minnesotans stay healthy and can help our communities. And lastly, members, I greatly appreciate the increase in inpatient hospital payment changes. This will give more money to our hospitals and allow for that much needed and overdue rebasing, and particularly with mental health services. So Senator Laurie, I can't imagine how tough this bill must have been. And yes, there are disappointments that I see in this bill and missed opportunities, but I do find plenty of things in this bill that will earn my green vote and will be good for the people that I represent.
Further discussion. Senator Dames.
Well, thank you, Madam President, and I'd like to thank the conference committee that worked on this, Senator Laurie and all the other committee members. This has to be a tough job. This is a tough budget, and this is a tough one to work with. But I too am a little disappointed, and rather shouldn't say little, I should say very disappointed in the outcome of the MNsure program. But we'll just move on with that and see if we can't tackle that another day and make sure that thing starts working to where it does what we thought it was going to do to start with. Because if we can get it to do that, we can put a lot more dollars into the Health and Human Services, or maybe say save a lot more dollars. But with that said, I just wanted to thank the committee and Senator Laurie especially for some of the items that we did get into this bill. You've heard me talk before about rural nursing homes and the financial disparity and the financial problems they have, and this bill will certainly help those folks make these nursing homes much more stable, and that is really important to rural Minnesota. In many cases, these nursing homes are the largest employer in the community, and so they're very vital, and also very vital to serve the members in that community with their nursing home needs. So thank you very much for that. Also, the buybacks on the cuts to the MAEPD program certainly is going to be very helpful for our disabled, and the disabled spend down eligibility change is certainly good for the elderly and disabled. So there's a lot of other good things in the bill, and I would just like to thank the folks for putting this together, and again, especially for helping out the rural nursing homes. That's a real major issue, and we certainly do appreciate it, and I will be voting on this for this bill.
Senator Franson.
Thank you, Madam President. I rise in support of this bill and ask members to do the same. I want to start off by thanking not only Senator Laurie and the conferees, but everyone who had some input into this bill, especially the staff who's worked tirelessly to get this to us in a very, very short time frame. We just met until 5, I think 5:30 in the morning, and we have a bill in less than 24 hours right back to us for consideration in front of you. So that takes a lot of time, and I want to take a moment to really thank the Revisor's Office and everyone who worked so hard to get this to where it is today. And I do have a lot of areas in this bill that I support and I'm very proud of, and it is tough work when you have to prioritize all the needs in this area and to single it out or to simplify the work in HHS to MNsure. I think it's a disservice to the work that's done in HHS on a daily basis. So I invite anybody who is interested to stop by the committee and be part of the discussion, because it is a very, very detailed oriented, and a lot of minutia and a lot of details do matter. And in this bill in particular, I was very, very proud with the Senate version and their Senate coming in with a strong bill, which to Senator Sharon's comments was really focused on investing in programs that had a great return on investment for taxpayers and really trying to bend that cost curve for our increasing cost of health care that we all know about. And MNsure's not going to fix it. There's so many other components in health and human services, housing, mental health, rate reimbursements. There are so many different moving pieces and different areas that we need to address, that to single something out as just MNsure's going to fix the problem, I think it's really not understanding the difference, the changes and the challenges, and the lack of understanding of how complex the Health and Human Services budget area really is. I do want to mention a few areas that I supported and authored that I am grateful they are included in this bill, including the 2% rate increase for chemical dependency that Senator Sharon mentioned as well. It's been more than 20 years where we haven't seen an increase there, and this really is treatment of services to maintain and increase access to high quality, cost-effective care that is tied to reducing ER visits, hospital stays, and incarceration. So this is one of those tools that we have in our toolbox to really try to bend that curve. So I'm proud that that's included in this bill. Another area is the Gillette Children's Hospital rate increase from 44 cents on the dollar to 62 cents to treat kids with disability and complex medical conditions. This facility in our state we're very lucky to have. It's world-renowned, and a lot of our MA patients are using this facility, and we certainly have to support the reimbursement rates to take care of our most vulnerable kids in our state. The fetal alcohol spectrum disorder funding as well, I'm addressing 100% preventable disability, and reduce prenatal alcohol exposure. That's another area that we don't talk about, that it's almost not even addressed in our school system, but it's 100% preventable, and this bill does move in that direction to really work with those mothers and make sure that we have newborns that are toxic free. So I'm very proud that we have some funding to expand that system in that particular area across our state. Another area is evidence-based targeted family home visiting, which serves first-time low-income pregnant women starting early in pregnancy and through the child's second birthday. So we know that this is an evidence-based area where we can also make a very big headway in trying to cost contain and to target and prevent later costs in the system if we are addressing them early with families. So great to have that there too. Another area that we funded in this bill is the Poison Control Center, which a lot of us, I'm sure in this chamber, probably have had some access to that particular service to our state. It's actually housed in the HCMC hospital, and they provide the service from that hospital to the entire state, really trying to answer all the requests from all of our counties. All 87 counties are served by this statewide program, answering 48,446 calls a year. And lastly, the stroke system, a system that we're trying to also set into place throughout the state, and it's a network of ambulance services and acute care hospitals in Minnesota, meeting the national standards of treatment of acute stroke patients. We're also expanding that throughout the state with this bill, and we're trying to get access to make sure that our citizens and our constituents who suffer from stroke have the access to the best care in a very short time frame, and again, saving costs in the long run because we're able to treat them earlier. And other bills that I strongly support in this bill are the Homeless Youth Act and the reducing the sliding fee waiting list and CCAP. Those two areas, I've received a lot of correspondence from my district, and I know a lot of you have as well, in terms of supporting our youth and supporting our families to be able to afford to go to work and be productive citizens of our society. However, I also have my disappointments in the bill. No bill is perfect. And I stand in disagreement as to some of the shifts and gimmicks that were contained in this bill. And despite fighting them in conference committee, they still made their way through the conference committee process. And in particular, I was disappointed to see that from the beginning we had a cut in our Health and Human Services budget with a negative target, and that was $328 million. And frankly, it was robbing Peter to pay Paul. We actually increased premiums for our working poor in MinnesotaCare. Yes, we saved MinnesotaCare, but I don't think that was even an honest proposal to begin with, because we know we had no alternative to how to deal with a population that we have a model program in our state, nationally renowned, and we had initially some offers to get rid of it from the get-go, and I think that was also not even a starting point of our negotiations. And we're now asking people in MinnesotaCare from 150 to 200% of the poverty level to actually pay more for their health care costs while we have a budget surplus. So I don't know if that's the right policy for our state. I certainly don't agree with it, and I think this bill falls short in that regard. And in terms of shifts and delaying payments, I, along many of my colleagues in this chamber, Madam President, ran against shifts and gimmicks, and now I know that we have some in this bill, and I have to swallow that, and because our counterparts insisted on them, and we started again with bigger shifts and gimmicks, like a $300 million fake savings that was proposed initially in our conference committee, and eliminated again MinnesotaCare, which really doesn't solve the cost in healthcare. So let's remember where we started, and with a fake budget, and where we are today. And certainly I have a reservation in that regard for this bill, but the good of this bill and the results for our elderly, our seniors, our mental health population, our children, and our homeless Minnesotans really outweigh the flaws in this bill. And that is why, in the spirit of compromise and in recognition of divided government, I stand here as Vice Chair of the committee to ask for your support. And certainly we're here to answer any questions in a complex area of health and human services. And I'm really proud of the work that we've done in terms of the environment that we're under. So thank you, Madam Chair, and I really urge members to support this bill.
Senator Marty.
Madam President, I want to thank Senator Lori and the conferees for doing a great job with a complex budget with difficult targets. I want to make one point, however. Earlier this year, the legislature had faced an avian flu crisis, and we treated it as a crisis. We have 175,000 kids who are growing up in poverty in this state, and that seems never to be a crisis. We've gone 30 years now without any increase in MFIP. I think that's a crisis. I think we ought to treat it with the urgency we treated avian flu. That was a crisis, and this is a crisis as well. So I'm disappointed we never seem to be able to move on that, but thank you for the conferees for their good work.
Senator Rosen.
Well, thank you, Madam President. And I stand here actually disappointed, Madam President, that this is a very important bill that affects real lives, and we have half a chamber. So the people that were standing up here and complaining about this bill that I think has actually done a very good job with the conferees and Senator Lori's work in the House, we've done actually a very good bill here. And even though it's got an 18.8% increase in the tails, we have the responsibility in this state for our aging, our vulnerable, and our children. And that's what this bill does. And it does a lot more than that. So, Senator Lori, thank you for including us, all of us conferees. I've been on Health and Human Services, Health and Human Sacrifice, that's what it's an endearing term, for a very long time. And I don't think I've ever felt more included in a conference committee or in a committee as you have done for us. And as you can tell, the breadth of knowledge that all of these conferees have about this subject area is quite impressive. So I'm a little disappointed that people are talking about this bill when they actually did not read the bill and really don't understand that the lives that are affected, and I'm getting a cold, that's why I sound a little shaky here, but I'm going to lose my voice. We started off in this conference committee 1.4 billion difference with the House and the Senate. That is a tremendous difference, and I really didn't think we were going to be able to pull it together, but we did. And thanks to the leadership of both Representative Dean and Senator Lori, they pulled it off with the conferees. We had some responsibilities in this bill, too, that we had to pay for. MSOP. We also had the Jensen settlement. We had the state-operated services. Those were things we had to pay for. And we also had the responsibility to the Child Protection Task Force recommendations, $52 million. We satisfied that responsibility. We also did a very good job with mental health. I wish we could do more, but we are getting very good at mental health, and we are making that a priority, and I do appreciate that. The little thing that I think is very important that everybody should listen to on this in this chamber is about the positive alternatives and the safe place for newborns. That's very important for many, many members in this chamber. The House came to the table with this proposal to blow up MinnesotaCare, and we were able to actually save that and had a very positive outcome with an increased premium for this Cadillac plan, and that was a good compromise, I believe. There is a lot of wonderful initiatives in this bill for Greater Minnesota. And we could go on and on about long-term care, but that has been sorely underfunded for a very long time, as long as I have been here. So we made that a priority. The Senate came to the table with a different proposal or way of funding it, but it was a priority for Senator Lori. Of course it was, because he carried the bill. But we spent $135 million on long-term care. That's pretty impressive. Another very wonderful proposal for Greater Minnesota for all of this state is telemedicine, something that we compromised on from the House, and it's probably one of the best initiatives, forward-thinking proposals out there, because that is going to move our healthcare system forward. It's an investment in the state. For the metro, for our disabled, so they don't have to travel a long way into the metro for their care, for Greater Minnesota, for our rural hospitals to be able to keep our patients in their facilities in their hometown, and to get the proper care. And you think about telemedicine, what it can do, whether it's mental health, chemical dependency, for stroke medicine, it's quite impressive. And then of course dental. Worked very, very hard on dental with a large group of stakeholders that I like to personally thank, not every single one of them right here, but I would, because we met diligently since August trying to figure out this quagmire of dental care in this state, and it's very complicated, very passion, there's a lot of passion in that, and we will continue to work on this. But I do appreciate the funding for increased rates for the dentist outside the 7-county metro. That is a big deal for Greater Minnesota because we have a terrible access problem for our MA patients. And as far as MNsure members, and there's been some bashing of MNsure, and I have certainly done my share of bashing of MNsure, but this proposal in this bill is the House proposal, members. It was Representative Mack's proposal. That was a compromise. So is it what we all wanted? No, it's not what I wanted. I wanted much, much more out of MNsure. I didn't get it, but we got the best we could because, frankly, they wanted to blow it up. So that's where we started from. So, Senator Lori, I wanted to thank you. I wanted to thank Senator Franzen, Senator Sharon. It's been an honor to sit on your committee, too. Senator Sharon, Senator Hayden. Always enjoy your common sense approach. And of course the staff. You guys are rock stars, and I am in awe of your work and your guidance. So please support this bill. It's a very good bill.
Further discussion. Senator Torres-Ray.
Thank you, Madam President. I know everybody's ready to go home, but I needed to say this because I have had a lot of constituents who have come to visit me to say that I should oppose this bill. And I have to tell them that I am prepared to support this bill, and I will be voting green. I want to thank the members of the committee and the chair. I think that the work that has been done is remarkable. A lot of the people who came to tell me that I should not support this bill are not people who are in the MinnesotaCare program. They actually serve these families. They work for the multiple departments and the counties. And I think what was important in their message and it resonated with me was, you know, many people think that these families live in our city. Actually, 25 counties with the highest percentage of people in MinnesotaCare are in Greater Minnesota. And the individuals who qualify for MinnesotaCare earn between $16,000 and $24,000. And clearly, a lot of these individuals are farmers. So I have to let my district know that I am incredibly appreciative of the work of this committee. And Senator Rosen was correct. Many people have not read this bill. And I would like to encourage them to read it, because what is in this bill is incredibly important. And I know that I have the commitment of our members, particularly the members in this conference committee, to continue to work on this issue so that we can protect these families who are the lowest income in the state of Minnesota. So thank you, members, for your hard work on this bill. This is very important to many constituents, and I think you did a remarkable job to bring us here. Thank you.
On the motion to adopt the conference committee report, all those in favor, please say aye. Opposed, say no. The motion prevails. Secretary will give Senate File 1458 its third reading.
Senate File.
Discussion. Senator Hand.
Thank you, Madam Chair, Madam President. I just want to make a very brief couple of comments. I do appreciate Senator Lori and the members of the committee and the conference committee that did the work on this bill. It is a very difficult area of the budget to deal with. It is a very large area of the budget, and it is a very significant area of the budget because it deals with a lot of very sensitive parts of our state and things that many, many of our citizens are very, very concerned about. So I appreciate the hard work. I know it is not easy. I do, however, feel compelled to make just a couple of comments. I cannot support this bill. I know this was a compromise agreement, and I appreciate that, but some compromises I think are worth supporting and others maybe not. I can't support this one. To me, the biggest challenge that we have is how to deal with health care. And I just have to say, we have spent the last 3 or 4 years implementing the federal health care program with the promise that this was going to save us money, that we were going to find a way to get health care costs under control. And now we have a budget that's going to raise the spending in this area of the budget by 15% in the current biennium and 18, almost 20% in the out biennium. And there is no sign at all that there is saving coming from this structure. There is no reform at all to the big cost drivers in healthcare. I believe, and there are others who believe, and maybe some of you don't believe, but I believe that the key to reform is a market. And we've got to start thinking about how to bring market dynamics to healthcare instead of how do you grow bigger programs, raise more taxes, and find more ways to spend money. That doesn't work. And I think this bill is proof of it. So members, I do appreciate we're trying to get through here tonight, and I appreciate that this is a bipartisan agreement, but it doesn't get at the key issue that we have in healthcare is how can we do this in a way that is sustainable? We cannot sustain spending at this level. We can't. We've got nothing left in the Healthcare Access Fund. We're going to come back in 2 years. What are we going to do? What's the budget going to look like then? How are we going to manage that? I think we have to quit kidding ourselves and come to grips with this. Maybe this isn't the right time. Maybe this is not the right dynamic to really address this issue, but we are going to have to address it at some point. So I can't support the compromise. I do appreciate the hard work that members have put in on this bill. I know it is tough. I know there's a lot of tough choices. And I certainly respect the work that people have put into it, but I just can't support it. And I think we're going to have to come back, obviously at another time, and take a harder look at this and figure out how to do this better.
Further discussion of Senate File 1458, Senator Laurie.
Thank you, Madam President. And I rise just to, in closing, at least take 1 minute to thank the conferees for their hard work on this bill. I think most of them have stood up and talked about all of the work that we've done. It is a real work of compromise, and it is done in a bipartisan fashion, and it's a piece of work that we're all pretty proud of, I think. And I'd like also to thank the staff who worked hard on this bill: Pat Rooney, Stacy Weeks, Megan Tolbert, Amy Gretzky, Lydia Loden, and nonpartisan staff as well: Joan White, Katie Kavanaugh, Liam Monahan, and our fiscal analyst, Dennis Albrecht. And I also want to say thank you to the House conferees and their staff for their patience and candor through this process. It was a very intense conference committee, but we all got together and decided what we could do and did it, and decided what we couldn't do and didn't spend an undue amount of time arguing about it. And I really valued that process that we went through and look forward to working with them again next year, and ask for member support. Thank you again.
Secretary will take the roll on Senate File 14.
She's got to finish her third reading.
I thought you called on him. You called on him.
We're going to continue the third reading.
Senate File Number 1458, a bill for an act relating to state government, establishing the Health and Human Services budget.
Reading. Secretary will take the roll on Senate File 1458. Members, I will announce that we are going to wait for conferees to return to the chamber so that they can vote. So please be patient. Secretary will close the roll. There being 49 ayes and 16 nays, the bill is passed and its title agreed to. Remaining on motion